Yes. So we are live now. So this is yeah. Hello, Dr. Walid Shanaa.
Hello.
Yeah. You have improved a lot. I can notice that. What all I'm suggesting, you are implementing. So what I would like to ask you is why you are taking all my suggestions so seriously, and why, how could you make this much improvement or change? And what do you feel regarding this type of training? You tell in your own words, 3 or 4 sentences, please.
I found your
Okay, first of all, give you information about yourself.
yeah, I am Dr. Walid, and I found you in teachers of Peter Smith in the Telegram. I sent to him to help me, and we started courses from the last week, 1 week. He gave me suggestions and instruction in other way, other than other teachers, regarding how to write the sentences in correct way and high quality manner. Yeah. So I get this instruction, I write it down, and I implement it in my writing in every letter.
Okay. Now tell me, what are the difference? Why you are implementing these things?
Excuse me?
What is the benefit you are getting by following these things?
Yeah, the benefit, I told, I have the confidence, I know the correct way of writing sentences, and I know how to analyze the case note and how to write in proper and correct way.
Okay. Right. So we are starting the session now. This is the feedback. So this is Dr. Walid Shanaa, and the topic is yes, here. Right. Alexandra Holme is the name of the patient, and here. This is the topic. What is the topic? Okay. Yes. Right. Okay, painful urination for 3 days. Positive home pregnancy test. Right. Now here is the case notes. Dr. Walid, you took from here, right? Yeah. Alexandra Home. Right. This is the letter. Alexandra Home. Fine. So this is preeclampsia, subjective, objective assessment, treatment plan. Okay. Right. Assessment. Needs antenatal referral. So requires antenatal referral to an obstetrician, and in view of a history of severe preeclampsia and cesarean section. Okay, so this is it. So you can say cesarean section, you can use severe preeclampsia. So right. So Miss Sangeeta Devi. So here I have given you one correction for one lecture. You can go through this one. So letter correction I have given. Miss Alexandra Holme, pregnancy test and positive and painful urination. Yes. Study the case notes. The purpose of the letter future. So, Dr. Walid, can you see here? There are 4 parts in the introduction. This is A. Dr. Walid?
Yeah.
I have given some corrections. While giving corrections, I gave some lecture in between. Okay.
Okay.
So you can go through these things. So this is the address. Right. Where are the dates? I'll send you personally here. Walid Shanaa. This is a letter which I corrected. Routine. So this is for your reference. There are points, lot of points I've explained. So you can go through those points. Was diagnosed with past tense. Has written this letter because she wanted to learn. She asked me, sir, I want to learn this. Okay, fine. You told her, very good, very good. Sir. Depend on your weight. The beginnings of introduction. Thank you for seeing. I am referring Mrs. Alexandra Holme. So here you are using these three styles in the introduction. Then the present condition. The present condition. The present condition. Whose signs and symptoms are consistent with? Who was diagnosed with? Who underwent? So whose signs and symptoms are consistent with? Both the sides there will be commas. Who was diagnosed with? So this is the way how you are going to write. So this is called the present condition. The next one is the purpose. This is the future purpose, the purpose of the letter. Okay. That is future expectation, expectations in the future. The future expectations. Here Rajkumar is there. Hello Rajkumar, you have some question?
Yes, sir.
Today, right?
Yeah.
That means today is present tense. Okay?
Okay, sir.
Everyone has got right in the D. This is type of letter. If it is a referral letter, you say refer. Okay. This is type of letter. The type of letter. Okay. Now here, he is being referred. He is being discharged. He is being transferred. Following his discharge, following his transfer, back into your care. That's why the problem. Fine. So here we have noticed these things now. Right. Positive, pregnancy test positive and painful urination. Okay. Right. Positive home pregnancy test. And antenatal evaluation and management. So you have to see different people will write different styles. It's not that only one style you will be. So you think which is the most appropriate one. So that one you take. Right. So So you can say emergency cesarean section. This is the most one. Emergency cesarean section. Her first mother, first pregnancy require emergency cesarean section. So this is not the one now. Okay, fine. So today's complaint. So this is more important. So complaint, painful urination. Okay. So today's complaint. This is what you have to notice. Right, that will go here. Okay. Right. Now let us go to the case notes. You are referring. So here it is. Right. This is first pregnancy. Alexandra Holme is a patient in your clinic who you believe will need to visit a family medical clinic for further evaluation. So further evaluation, you have to understand here. Next one. So this is first pregnancy, very old. Second pregnancy. Okay. Now. So now subjective one here. So positive home pregnancy test. This is the fifth pregnancy. And for 3 days, painful urination. This is the problem. So that's it. She came with the complaint. Okay. So this is the problem. So you can take both these things. Positive home pregnancy test, number 1. Positive home pregnancy test and painful urination. These are the two different things. So here, these are the two things you have to notice. Number 1 and number 2, painful urination. Who presented? Okay. So today, this is what it is. So you can take these two things, positive home pregnancy test and painful urination. So let's take one of that. So you have to select anyone. Right. So this is the problem. Always case notes is related to problems. So write problems. Right? Problems. So now let us see corrections. I'll show you step by step. Step by step. Right. Review. So first one, step by step. Okay. Now you see here, this is Dr. Mary Perry. Dr. Mary Perry. This is what? So you are going to, using the information given in the case notes, write a letter of referral. So is being referred. Right, passive voice. Don't say I am referring. I am referring. 9 out of 10 will write. They are ordinary people. 1% will write in the passive voice. Is being referred. So special. That's it. Is being referred. So Dr. Walid, do you want to write like normal, like everyone writes like active voice because they don't know what is passive voice? Or now that you are learning very well, you want to write in passive voice? What do you want, Dr. Walid?
No, I find passive voice is better. It is directed to the patient, and the main aim, as you told in our writing, is the patient-directed care writing.
Okay. So this is a referral letter. Because this is a referral letter, now you can write 2 forms here. You can write 2 forms. So number one is I am referring. I am referring. The TJS is the one. TJS, please. I am referring. Dash, dash, dash. I am referring. So I, the person who is doing, is coming, he is important, he is the subject of the sentence. This is called active voice. This is called active voice. And is being referred. Okay. This is passive voice. Okay. Now here there are 2 different things. I am referring. Whom we are referring? Miss Holmes. I am referring Miss Holmes. Right. I am referring Miss Holmes. Now I is important here. I is important here. That is what you are making. So that is the quality which is very cheap. Now here what we will do is, instead of I, you will say Miss Holmes is being referred. This is passive voice. Now whichever you want to use, you use. First one is ordinary quality, which anybody can write. I am referring Miss Holmes. Anybody can write like this. Miss Holmes is being referred. Only 1 out of 10 can write. So this is what OET is asking. So try to write like that one. So referral. Next one, the address is here. The address is here. Dr. Mary Perry. Dr. Mary Perry. So Dr. Mary Perry. Correct. Then next one. consultant obstetrician, consultant obstetrician, consultant obstetrician. Fine. Right. Next one is family medical center. Right. Then next one is all mothers hospital. All mothers hospital. Right. Next one is Alfred Street. Right. Then next one is South Cottingham. Yes, that's right. Next one is date. Date is here. Okay. So where is the date? So right. So no date, right? So today's date you have written, correct? So this no problem because you will write the always you will write the yesterday's letter. So you will always write the date on which you are writing the same date you will write. So no problem. So that is the date. Yesterday you have written this letter and 26 December 2021. But you made a mistake here. Oh, 1 second. Let me check your writing, handwriting. Okay. Yeah, see here 26 December 2021. So here no space. So you have to leave space between 26 and December. And you have to leave space here. Is that clear, Dr. Walid?
Yes.
You have to leave proper space, single letter space. Leave single letter space between date and month, month and year. Okay. After every word, leave a single letter space. That's what I tell you. Leave a single letter space. Fine. Right. So that is the problem here. So it is like this. What you have written is like this. So that is not fine. So what we have to do is, sorry. Right. What you have to do is, you have to leave single letter space. Leave single letter space. After 26, you have to leave single letter space. After December, you have to leave single letter space like this. Okay. Then, dear Dr. Perry. Okay. Here, dear Dr. Perry. Next one. Regarding Miss Alexandra Holme, date of birth 11 July 1972. Date of birth. Okay. So 11 July 1972. Okay. This is it. 11 July 1972. You have to write in full 1972. Right. That's fine. So regarding Miss Alexandra Holme, date of birth 11 July 1972. Fine. So thank you for seeing, not seen, it is seeing. Thank you for seeing. Thank you. Thank you for seeing. Thank you for seeing Miss Holme, who is pregnant at 8 weeks. Okay, with a history of severe preeclampsia and cesarean section. Okay. So now, right. So see here what else you can write. Where is the word? Why did you not use the word refer? Why did you not use the word refer? Okay. I am referring for. I am referring for. Why did you not write that? Purpose is missing. Do you understand, Dr. Walid?
Yes.
You did not write why you are writing this letter, first of all, correct?
Okay.
That should be in the beginning only, no? You are referring this letter for what? What purpose?
Yeah, can I add here in the introduction after this sentence with a history of severe preeclampsia and cesarean
Yeah, you
section?
can say I am referring her for.
Yeah,
Okay.
if I wrote for what she require an antenatal care,
Yeah, you have to write like that.
can I
Okay.
write like that, or I need to?
Yes, you can write I am referring her for what? That is the main purpose that is missing. Okay. We don't know why you are writing. Just because she has this history, she has a cesarean section, and because she is pregnant at 8 weeks, you are referring what you are expecting from him. What do you want him to do? That is more important. What he can do, which you cannot do. That is the point there. Okay. Then only you will refer. Then only you can refer. So here you can write like this. Okay. You can say Miss Holme, comma. Okay. Miss Holme, comma. Right. Who presented with? Right. Okay. So this is the point. Painful urination. Positive. Two things I have showed you. Positive home pregnancy test and painful urination. Okay. These are the 2 points. And we are requesting referral. Right. To the Spirit Mothers Hospital for antenatal care and birth. So remember this. These are the 2 things. Antenatal care and birth. Right. See here now. Antenatal referral. Okay. Antenatal referral. Treatment plan. Treatment plan. Follow-up treatment. Right. So follow up all these things. This is very, very essential. What you are writing is more important. What you're writing is more important. Fine. So you can write like this, and then you can say who comma is being referred for why. Now you understand?
Yes.
Okay, so simple now. Miss Holme, who dash 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 is being referred for dash dash dash. Okay.
Okay.
Miss Holme, for example, Mr. Gerald Baker, who has unstable diabetes mellitus, is being referred for stabilizing blood sugar levels. Is that clear?
Yes, clear.
This is the problem. This is the solution. Solution is the purpose. Okay. Problem is the present condition. Solution is the future purpose. Okay.
Okay.
Is that clear now?
Yes, yes, I get.
So however you want to write, you can write. I'm giving you here. This is in brackets. So however you want to write, you can write. Okay, one sentence. Earlier you have written here, you are making two sentences. But if you are writing like this, this is one sentence. This is just one sentence. Okay. But if you are writing like this, you are saying thank you for seeing. Then again, I am referring. Both are ordinary sentences. But here, if you say Miss Holme, who is being referred, then it is passive voice. Right. So this is the better option. Right. Next. Miss Holme is a mother of two children aged 8, 3 and 5. Why did you write 8? No need 8. Okay. No need 8. Miss Holme is a mother of two children. Miss Holme is a mother of two children. Okay. Right. Now let us see the point there. I'm going to show you one question. Miss Holme, right. Is this Miss or Mrs.? Now you tell me. Dr. Walid.
Yeah, Mrs.
Is this Miss or Mrs.?
Mr.
Then why did you write Miss? Because Miss means it's a doubtful case, Mrs. Now there are a lot of meanings. This is called title. Title should be very clear. So
Okay.
it is Mrs. Alexandra Holme. Mrs. Alexandra Holme. Remember that. Fine. Okay. Now she is going for pregnancy. Okay. That's it. So you can understand the story behind it. So you have to be very clear here. This is Mrs. Husband is there. Okay. Mr. Holme is there. Fine. So Mrs. Alexander. So she is married and she is in the bond of marriage. And now she is going for a delivery. And that is 5th delivery. So you have to understand all these points. And it is Mrs., not Miss. How did I know without checking? So like that. So you have to be very careful. Right. Regarding Miss, is this Miss or Mrs.? Now you have to say Mrs., right?
Okay.
Okay. There are a lot of things you have to see. You have to be very careful when you are giving a title. Okay. You cannot call Mrs. as Miss and Miss as Mrs. Both are equally dangerous. Okay. Next. So Mrs. Holme. Fine. Right. Mrs. Alexandra Holme. Fine. 2 children. Fine. Aged 3 and 5. And has a history of 2 miscarriages. Okay. Her first pregnancy was complicated by severe preeclampsia, which required an emergency cesarean section at 32 weeks. Very good. Therefore, her baby was admitted into intensive care unit. 2 means unit. For means care. She was admitted for intensive care. The baby was admitted for intensive care or 2 intensive care unit. Is that clear?
Yeah.
Okay. So admitted for care, but 2 unit. So therefore her baby was admitted for intensive care in the unit for 3 days. That is the meaning. So you have to be careful. So for
2
intensive care or
unit
into the
for 3 days.
Baby was admitted into the in the intensive care unit. Correct? ICU. Admitted to care or admitted in the intensive care unit. Which is right?
In the intensive care unit.
So admitted for intensive care, correct? So if you are doubtful, then you can write admitted for intensive care. Okay.
Okay.
Is that clear?
Yeah, but for intensive care for 3 days, it can be.
So intensive care for 3 days, that is what you have written, na? So you see the case notes. Where did you pick the information from?
Yeah, for 3 days. For 3 days.
Intensive care for 3 days. Yes, she was under the care of specialists. So that means intensive care unit only, right?
Right.
So, fine. Okay. So, right. In intensive care was admitted for intensive care or admitted in intensive care. Fine. The second pregnancy passed smoothly or smoothly? Okay.
Smoothly.
And she delivered at full term. Okay. A history of heterozygous for factor U Leiden. Leiden small letter or capital letter?
No, small.
Okay. And family history of thrombosis were reported. Okay. Therefore, so here, therefore, comma, you made it a reverse. Okay. Therefore, comma. Is that clear now?
Yeah.
The parent was given in the 2 previous pregnancies. In the 2 previous pregnancies. In the previous 2 pregnancies. Okay. In the 2 previous pregnancies, no? You got it?
Yes.
In the 2 previous pregnancies. The parent was given in the 2 previous pregnancies. So try to get the idea there. In the previous 2 pregnancies or in the 2 previous pregnancies. So just check it out. Okay. Two previous pregnancies. The 2. Yes. In the 2 previous pregnancies. Okay. Miss Holmes presented today complaint from painful urination. So, why you want to write Miss Holmes every paragraph? I don't understand. Is it needed? Okay, if you cannot help, okay, you can write. If you cannot manage, you can write. Okay. Just you can say like this: today, okay. Today, during today's visit, you can write like that also. Okay. Painful urination over the last 3 days was reported. Finished. Is that clear?
Yeah.
Instead of writing active voice, write passive voice, no?
Yeah, clear.
Okay. She is currently 8 weeks pregnant. Okay. Right. The next one. Urinary tract infection was confirmed by urine test. Very good. Urinary tract infection was confirmed by urine test. Sorry. Blood pressure was 120/80. Okay. The next one. Urine test which was ordered confirmed. Urine test which was ordered confirmed urinary tract infection. Okay. Which
Yeah,
was
no.
ordered. Passive voice you can write. Fine.
Which
Blood
was
pressure,
Mhm.
urine test which was ordered. You ordered for test, right?
Yes,
So
right.
that test confirmed. The reports confirmed. Okay. Was confirmed by urine test. Okay, fine. This is also correct. This is not wrong. Blood pressure was 120/80. Weight was 64 kg and height is. What is this? Is one single is.
Because the height is not changeable.
See, actually, today means present tense, right?
Mm.
Then how can you use past tense?
No, I write the present because the height is not changeable. Is not yesterday will be 170 and today 200. It is the same. That I mean.
No. Then weight also can be same then.
Weight can be changed. Weight can be after 1
Height
month,
also
before
can
1 month.
change. Height also can change. It can increase maybe after 1 week. But we
The
are
height,
not talking about 1 week. We are talking about today.
okay.
Today it will change weight. Today weight was 64 kg. Today weight was 64 kg.
No, I am talking today, maybe in the morning.
In the morning. You did not say in the morning. You just said today, no?
Today.
You got it, what I'm telling you. So be careful when you are saying the words today. These are markers, okay? If you
Okay.
are saying today, it is present tense. If you say today morning, so today itself is present tense. Yesterday is past tense. Tomorrow, today, day, this day, previous day, next day. You are dividing time based on day, okay?
Okay.
So yesterday is past tense. Today is present tense. Tomorrow is future tense. If you say this morning, so morning, this morning, last morning, next morning, so morning. So you can use present perfect tense.
Present perfect.
Okay. So blood pressure of 80, 180/80, weight 64 kgs weight, and height 167 were noticed. Finished, no? Why do you want to say was or is? Have been registered or recorded, correct?
Correct.
So that's enough. So write present perfect. Today, on examination, blood pressure of 120 by 80, weight at 64 kg, and height of 167 centimeters were registered in the book. Okay.
Were registered.
Or have been registered. Were means past tense. Have been registered. Finished. Present perfect. Fine. So when you are using today, if you don't write today, okay. Next one, she requested. So you have to be very careful. So one you are writing past tense and one you are writing present tense. It is confusing there. What reason you are giving? Okay, that sounds fine, but that doesn't suit here when you are saying today. Okay, this is called the time marker. Today means present tense. Yesterday, you are dividing time based on day. Today, yesterday, tomorrow. Yesterday is past tense, today is present tense. Okay, at 10 o'clock. Or now means this time, this hour, this minute, previous minute, next minute, this month, previous month, next month. So we are dividing based on the time factor. So this month means month is the factor. Day, today means today is the factor. Day is the, so today is present tense, natural. So you have to think like that. The next one, urinary tract infection was cut. Okay. So be careful with this.
So if the height, if the all the tense in the paragraph is in the past and the height, I should height change or change all.
No, this today is there. No, today. Today means present tense, complete present tense.
Okay.
Okay. Or you can say before 2 hours means it is past tense. Okay. So you can say today, not was, has been reported. Now you understand?
Has been reported. Okay.
Okay. Because you are saying today. She is currently 8 weeks pregnant. So this currently means presently, right?
Okay.
Presently means now, right?
Mm-hmm.
So currently take it forward, comma. Currently, small letter S. Currently, she is 8 weeks pregnant. Okay. Urinary tract infection was confirmed by urine test. Okay, this you can say. Urine test which was ordered confirmed urine, okay, revealed urinary tract infection or something like that. So you can write passive voice. Blood pressure of 120 by 80, weight
At 68.
at 68 kg and height of 167 centimeters have been registered. Present tense. Today's, these are all on examination today. On examination today. On examination. Today is already there above, so no need again. On examination, blood pressure of 120 by 80, comma, weight at 64 kg and height of 67 centimeters have been registered. Urine test, full stop. So, urinary tract infection has been confirmed. So you can write all present perfect because today, currently is present tense, today is present tense, everything is telling present tense, right? So was confirmed. Of course, you can write definitely, but you have to show the relation from present to past. Then only you can say was confirmed. If you are writing present tense, it should be has been confirmed, okay?
Okay.
You understand?
Yeah. Present perfect can be used in the same day.
Yeah.
Present perfect. This is present perfect.
Present perfect means finished. Action finished in the present is present perfect. Okay. By the urine test. Okay. Then she requested a referral to the spirit. She requested. Why do you want to write she requested?
She requested, huh?
A referral to the spirit. Why a referral to the spirit hospital for antenatal care and birth has been requested. Okay.
Requested by who?
Yeah, by her only, na?
By her.
Okay, she requested. Who is this she? Huh? Who is this she? Tell me.
She.
She only. Has been requested. Requested by whom? She only. Okay, recommended means you, doctor.
Okay.
Is that clear?
I have confusion because
doctor will suggest, a doctor will recommend, a doctor will counsel, but patient only requests, right?
But if I said she requests a referral to, it is not clear, not right.
She requested is active voice.
Active. Okay.
I'm asking you to avoid passive voice, no? Avoid active voice, no? Is that clear?
Yeah.
So here, these are about the past tenses, right? First pregnancy means past, right? So everywhere passive. Okay, her first pregnancy. First pregnancy means now this is fifth pregnancy. First pregnancy is definitely past, right?
Right.
The second pregnancy, this is past. So you are writing past. Past tense you are using. Definitely, that's fine, was given. But here today, currently, these are the words you have to recall. Okay.
Okay.
Then, based on the aforementioned circumstances, further evaluation and appropriate management, you can say, would be profoundly beneficial. Okay. Beneficial. Okay. To improve her condition, or like would be profoundly beneficial. That's enough. Please commence her on folic acid. Why? Okay. Please commence her on folic acid. Commencement of folic acid is advised. Why, please? Why should we request? Commencement. Why her only? Commencement on folic acid is advised. Is advised. And should be okay. Commencement of folic acid, which is advised, has to be continued until 12 weeks. Until for 12 weeks or until 12th week. Okay. Is that clear?
Yes.
Has to be continued until the 12th week or for 12 weeks. Which one you want to use? Until the 12th week or for 12 weeks. 12 weeks means period. Until means point of time.
No, until, because this 12 week means 12
until the
weeks of
12th
pregnancy.
week. Until week 12, you can say. Or until the 12th week. Not weeks. Okay. Has to be continued for 12 weeks. But 12th week is only 1 week, right? You got it?
Yes.
12th week, only 12th week. Until then, it should be continued. That is the meaning, right?
Yes.
Or it should be continued for 12 weeks. 12th means 1, but 12 means plural. Okay.
Okay.
All right. Is that clear?
Yes. What is advised has to be continued until the 12th
week. Full stop. Okay. Commencement on folic acid, which is advised, has to be continued until the folic acid has to be continued until the 12th week. Semicolon. Okay. Semicolon. No problem. Okay. Screening for Down syndrome has to be arranged. Screening for Down syndrome has to be arranged. Okay. Start to give her tinzaparin. This is again colon. So you are joining these 3 sentences using link. What do you call that? Lists. 3 things are you are making into a list. Okay, then tinzaparin. What is the spelling of tinzaparin?
This is tinzaparin.
Give her. Her is not needed. Only one is there. Tinzaparin 3500 units or unita. $3,500 unit or units. So control F 3,500. Okay, yeah. Needs to start at tinzaparin 3-5 units. Why did you not write this? Yes.
Units.
Be careful, no? Why did you not write this? Yes. 3,500 units daily. Okay. Needs to start tinzaparin. Tinzaparin or tinzaparin? What is right?
3,500 units.
Daily. Subcutaneously, right? So, you can write here. Tinzaparin, PA, okay. Tinzaparin 3,500 units, okay, daily, right? Daily, subcutaneously. Daily dosage of daily dosage, regular daily dosage. Okay, daily dosage of tinzaparin 3,500 units. Okay, so daily dosage of tinzaparin 3,500 units subcutaneously. Okay, subcutaneously. Okay, has to be initiated. Start means initiate. Okay, has to be commenced. Has to be commenced. Why people are getting 420? Because of this only. Quality is quality. Whatever you have written, that only I am modifying. I am not doing anything different. Okay. And cephalaxin, that also you can write along with this. And next one, cephalaxin. Commencement of, yeah, see here, commencement on folic acid, 400 micrograms daily. Okay, that is different. So next one here, cephalaxin. Okay, here it is. Okay, cephalaxin prescribed, has been prescribed. Cephalaxin 250 milligrams. And so 4 things are there. Screening for Down syndrome. Okay. Commencement on folic acid has to be continued. Number 1. Screening for Down syndrome has to be arranged. Daily dosage of tinzaparin subcutaneous has to be commenced. And cephalaxin 250 mg 6 hourly for 5 days has been prescribed. Is that clear?
Yeah, but you you make the quality higher than the previous now.
Yeah, you have to do no every time because you are doing good quality, so I am giving more quality.
You will give, you will put me in more challenge.
You don't want means tell me, I will reduce.
No. I need that. I need, but
Please.
really,
Why do you want to write please? What is the need for writing please? There is no need. Okay. So could you? Why could you please? Arrangement for neutral translucency scan and a social worker visit. Arrangement for neutral translucency scan and a social worker visit is recommended. Arrangement is recommended. Okay. Is recommended. Okay, fine. In case any further information, no. Additional information. Better. In case any additional information is required, comma, please do not hesitate to contact me. Yours sincerely, doctor. Is that clear?
yeah.
See, past tense, it is very easy for you. That's why you are not making too many mistakes. But present tense, okay,
Okay.
right? So her first pregnancy was complicated by severe preeclampsia, okay, which required an emergency cesarean section at 3 weeks. So this also you can make it into passive voice, which required an emergency cesarean section at 32 weeks was required. Okay, which required was it? And therefore, okay, right. Now here also, her first pregnancy was complicated by severe eclampsia. Okay. So complication of first, okay, complications during the first pregnancy. Complications during the first pregnancy. Okay. Complications by severe, okay, right, complications, remove her, avoid personal pronouns, avoid personal pronouns, complications by severe eclampsia during the first pregnancy was, okay. So complications, see capital letter. Complications by severe preeclampsia during the first pregnancy. During the first pregnancy was mentioned, was reported or mentioned. Okay. Right. Right. Ms. Holme is a mother of 2 children, age 3 and 5, and has a history of 2 miscarriages. Complications by severe preeclampsia during the first pregnancy was mentioned. Okay. Right. Full stop. For that reason, an emergency cesarean section at 32 weeks was required. Okay, was performed. Therefore, her baby was admitted for intensive care for 3 days. The second pregnancy passed smoothly, and she delivered at full term. A history of it is for fact. So, as far as possible, were reported, was given. See, this is passive voice. Try to write in passive voice. Fine. Is that clear, Dr. Walid, Shanaa?
Yeah.
So, all information is clear. Any doubts? So, now tell me, do you want the same style, or do you want me to minimize a little quality, and do you want me to maintain the same status quo?
No, it is good for me. But I have some comment here regarding the correction in the paragraph 1. in the paragraph 1, when we said it is required cesarean section and complicated by the pregnancy usually going smoothly. When we say it is complicated, I need to refer to something serious happened in the first pregnancy. Yeah, in the past, and to explain the reason for referral. During the first pregnancy was me.
So you can say like this. You can say like this. An emergency cesarean section at 32 weeks was required due to the complications by severe preeclampsia. Finished.
Yeah, this is very nice. Very nice word. An emergency cesarean section at 32 weeks was required for a complication of.
Now you are only in second level, okay? Afterwards, give you third level. You have to wait. Okay. Now this is done. Now tell me what do you feel regarding the session? Did you enjoy the session? What did you learn? What did you notice? Was this much needed?
But you didn't give me
am I
the
explaining
score.
you too much?
How much score mean for this letter?
Yeah, I will tell you. You tell me first this one. What did you learn today?
Yeah, I learned you give me positive feedback, and I appreciate that. And regarding this sentences, to make a positive, a passive voice, it is need skills. I need not easy to make the sentences in the passive. I have question here. It is no need to write even one or two active sentences.
No, you can write. There are some sentences which you cannot change into passive. Okay.
Okay.
Miss, for example, Mrs. Holmes is a mother of 2 children. You cannot change into passive.
Okay. In the first introduction, and you said I will write. I am referring here for an antenatal care and birth, or for more evaluation regarding antenatal care. What is the best?
Fine. So you can write both. You can write whatever he has given, whichever important you feel, you can write. What is that purpose you have to write? Is being referred for antenatal care and specialist evaluation, or you can say further evaluation, or definitive diagnosis and follow-up management. In this letter, what it different letters have different purpose. So see what he is giving there. So you can just check there what he is giving you. See here. Using the information given in the case notes, write a letter of referral to Mary Perry, consultant, obstetrician, Family Medical Center, All Mothers Hospital, Alfred Street, South. Nothing is there here. But here, if you see, okay, a lot of things he has given, right? Lot of things he has given. Okay. Needs antenatal referral to an obstetrician in view of the severe pre. So try to understand this one. Antenatal referral. So that is it. Then next one. This is the point. The next one, what it is.
I am referring here for antenatal care. Like that.
Yeah. And here it is more. Okay. Further evaluation, you can see here, right?
For further evaluation, yes.
Alexandra Holme is a patient in your clinic who you believe will need a visit a family medical clinic. Is that clear? For further evaluation, you got it now. That is why you are sending there.
I'm referring here for further evaluation, for antenatal
Yes.
care and further evaluation.
Yes. So that is also here. Fine.
Okay.
Who you believe that she needs further evaluation, but means it's not confirmed. You cannot say 100%, right?
Yes.
So you are taking a specialist opinion, okay?
Okay.
Fine, that's it. Okay. So, right. Now you see this writing, this is not extraordinary, this is average level. So this may go from 330 to maybe 370, 330 to 370, okay?
Okay. I need more than
Take the
400.
average, no problem. No doubt you have passed the test. This one, 350 is not a joke. You have written very nicely. I really appreciate.
Thank
Okay.
you. Thank you for positive feedback.
Yeah, that's how. Okay, then good night.
Good night. Thank you.
Right. I'll send this one to you, okay?
Okay. Please. Okay.
Right.